Hello everyone. Today we shall discuss regarding bladder cancer. Now, when we hear the word bladder in the human body, the function of the bladder is a temporary storage of the urine before it has been excreted out of the body. So now, if there is an abnormal uncontrolled growth happening within the bladder, we call it as a bladder cancer. So let us discuss in detail. Anatomy of the bladder, let us discuss first. That is, the bladder is a hollow muscular organ that serves as a temporary reservoir for urine, which is then discharged through the urethra. Now, bladder is basically a hollow, empty organ. Not only it's a hollow organ, but it's a muscular organ. So when bladder is a hollow muscular organ, the function that it plays is when the kidney produces the urine, the ureters carry the urine and empty it within the bladder. And so, the temporary storage of the urine before its excretion through the urethra is the only function when it comes to the urinary bladder within the human beings. Now, when we discuss the bladder cancer, as we know that the cancer is an abnormal, uncontrolled growth of the cells. Now, if this abnormal, uncontrolled growth of the cells is happening within the bladder, we call it as the bladder cancer. So, looking at the definition, it is the proliferation of abnormal tissue in one or more places within the bladder. So, proliferation is consisting of the growth of any abnormal tissue within one or more places within the urinary bladder. So, we call it as a bladder cancer. Now, as a cancerous growth is happening, the bladder is now exposed to a variety of the changes, and hence, because of this, the normal functioning of the bladder is starting to get affected. Now, looking at the classification of the types of the cancer that is being affected when it comes to the urinary bladder are the urothelial carcinomas, the squamous cell carcinomas, the adenocarcinomas, and the small cell tumors. So, it can be the urothelial carcinoma, it can be a squamous cell carcinoma, it can be an adenocarcinoma or a small cell tumors when it comes to the bladder cancer. So, let us discuss in detail. The first one is a urothelial carcinoma, arises from the epithelial layer of the bladder. Urothelial, the name itself suggests that within the bladder, if the cancerous growth is arising of the epithelial region, so we call it as a urothelial bladder cancer. Now, comprises of the 95% of the bladder tumors. Now, out of all the patients coming with the cases of the bladder cancer, 95% that are going to be reporting of the bladder tumors is going to be a urothelial carcinoma, which is the one that is starting from the epithelial layer of the bladder. Can be further divided into carcinoma in situ, non-invasive papillary carcinoma, and invasive papillary carcinoma and solid tumors. So now when the urothelial carcinoma is taken into consideration, it is further divided into carcinoma in situ, invasive and the non-invasive papillary carcinoma, and the solid tumors. Now the squamous cell carcinoma, that is the second type when it comes to the bladder cancer. It make up for 1% to 2% of the bladder cancer cases. So the squamous cell carcinoma is accounting for up to 1% or 2% of the bladder cancer cases. The third type is an adenocarcinoma, make up for the 1% of the bladder cancer cases. So out of all the bladder cancer cases that are coming, up to 1% is an adenocarcinoma. Small cell tumors make up approximately 1% of the bladder cancer cases. So now these are the few of the variety of the regions where the cancer is growing within the bladder. But out of all the different types, the urothelial carcinoma arising of the epithelial region is said to be having the highest occurrence rate. Now the risk factors. Now whenever the risk factors are taken into consideration within the cancers, these factors are not directly causing the cancer, but they are increasing the risk within a human body to cause the cancer if they have been exposed to these factors for a very long period of time. Taken into first is smoking. Smoking is being linked to a variety of the cancers. Not only the smoking is being linked to a variety of the cancers, it has been said to be affected to a certain amount for a variety of period of time. The patient is going to develop a cancer because of the smoking issues. The second is chemical exposures at work. The occupational hazards, when they come into considerations, the occupational hazards play a very much greater role within the human body. And not only that, the chemicals that are exposed at work, there are chances that these chemicals are gonna cause changes within the human body. And these changes, when exposed for a variety period of time, can lead to cancer development. After all, cancer is an abnormal growth, and these abnormal growth is happening for a very long period of time because of the minute changes that are happening within the body. Diet, a diet that is high in fat, low in antioxidants, these diet is causing and affecting the patient, and if it is patient is going to be taking for a very long time, it is going to be causing as a risk factor. Age. Since bladder cancer is associated with a variety of the factors, age is a very important factor to be taken into consideration, that the people are going to be affected after a particular age if they are exposed to the above mentioned risk factors. Personal history. If the patient has a prior history of a bladder cancer or any prior history of any type of the cancer, the chances of those patients for developing the bladder cancer in the later regions of the life is said to be considerably high. Family history. Again, the genes play a very important role when it comes to cancer, and hence family history needs to be taken into consideration when bladder cancer is being discussed. Chronic bladder inflammation. Now, if the bladder is being staying into an inflamed state due to a variety of the regions for a long period of time, so it is called as a chronic bladder inflammation. Not only the bladder is staying in a chronic bladder inflammation state, but the treatment has been getting is not consistent treatment. So because of that, when the patient is going to come for the diagnostic test with a history of a chronic bladder inflammation, the chances that the changes within the bladder's epithelial region are so high that the patient has been diagnosed with the bladder cancer. So these are the few of the risk factors, such as the smoking, the dietary pattern, the family history, the personal history, the exposure of the chemicals at work, that the patient is going to be an increased chances for developing the bladder cancer. The clinical manifestations. When the clinical manifestations are taken into consideration, the clinical manifestations are those conditions, symptoms that the body tries to show. When the changes in the body are happening to a certain higher amount, the body tries to show symptoms in some sort of the way. And when it comes to bladder cancer, when we see the function of the bladder, that is the storage of the urine. So if there is an abnormal cancerous growth happening within the bladder, what are the symptoms going to be? Let us discuss. Number one is hematuria. Hematuria is the presence of the blood within the urine. Since the bladder's primary function is storage of the urine, the cancerous growth is going to cause the hematuria within the patients. The second is pain during urination. Not only the presence of hematuria is there, but also the patient will be complaining of pain during urination. Polyuria, that is the patient will be having frequent urination, and the feeling to need to urinate without results. That is, the patient will be having the constant feeling that I need to urinate, I need to empty my bladder, but will not be able to do so. So these are the few symptoms that the patient experiences who is having a bladder cancer. As you can see, hematuria can be of two types. It can be gross hematuria and microhematuria. As you can see in the picture, gross hematuria, the multiple amount of the red blood cells are being present. The blood cells are present, and the microhematuria, very few amount is being present. Either it is a gross hematuria or a microhematuria, either of their chances for within the bladder cancer are high. Polyuria, frequent urination, the patient will be needing to empty their bladder very much within the few minutes of the times, and thus need to visit the washrooms, and they need to empty their bladder because the patient will be having frequent urination. Not only patient will be having frequent urination, the patient will be having the urge to urinate but won't be able to do so. Now looking at the stages of the bladder cancer. So when we are discussing the stages of the bladder cancer, the number one is a stage 0 bladder cancer. So as you can see in the picture, this is the bladder, hollow organ. These are the ureters. Now when we are taking maximizing the image, it can be seen as a stage 0A and the stage 0IS, that is the carcinoma in situ. So now the bladder has been surrounded by a fat region, fat tissue. These are the muscle layers of the bladder, followed by the connective tissue and the inner lining. So within the inner lining, if there is a cancerous growth happening, we call it as a non-invasive papillary carcinoma. So the non-invasive papillary carcinoma, so which is called as a stage 0A. Now, when we are seeing in the carcinoma in situ that again the inner lining has been affected, but the cancer is staying within that particular state. area and it is not moving out of it. So we are having the stage 0A and the carcinoma in situ. Now the furthermore stages of the bladder cancer are as such. Now moving at this first stage is again looking at the diagram of the cancer of the bladder. This one, the ureters empty the urine within the bladder. Bladder is surrounded by a fat layer. These are the ureteral openings, as you can see in the picture. The muscle layer surrounding the bladder, the trigone of the bladder, the neck region, the urethra and the prostate, which is present in the males. So now when we are discussing TIS, which is present in the mucosal lining. So TIS is a flat cancerous cells within the cell lining the bladder. So carcinoma in situ are basically flat cancerous cells and they are limited to the lining of the bladder. So the carcinoma in situ is called as the TIS, which is known as the lining, where only lining of the bladder has been affected with the cancerous growth, but they are not invading the surrounding structures. Now coming to the TA, which consists of just in the lining cells. So in the stage TA, what is it? That the stage just in the lining of the cancer cells are showing the growth. The stage T1 consists of into the first deep bladder layer. So when the cancer cell starts invading into the first deep bladder layer, we say it to be the T1 stage. The stage T2A just into the bladder muscle. So if the cancer is going into the stage T2A, now the muscle layer is starting to getting affected by the cancerous growth. Now stage T2B, as you can see, the amount of the cancer cells is increasing. So now deeply into the bladder muscle. So in the stage T2A, this bladder muscle is just slightly affected, but now in the stage T2B, the bladder muscle region is getting affected to a higher extent and there is a deep involvement of the muscle layer now. Looking at the stage 3A, it consists of the just into the bladder fat. Now the fat areas of the bladder tissue has been getting affected. Stage 3B, deep into the fat layer of the bladder. So now the cancer cells are trying to invade deep within the fat layers. And the stage T4, invading other organs around the bladder, prostate, cervix and the vagina. As you can see, the other regions are starting to affected, not only the inside regions but the outside regions herein, which is the urethra and the prostate. They are getting compressed because of the cancerous growth. So these are the stages of the bladder cancer. Moving on forward are the diagnostic tests. So the diagnostic tests are those tests that are being done to get a confirmatory diagnosis. So when we are discussing the bladder cancer, there are certain amount of the diagnostic tests that are taken into the consideration. These tests are done for those patients who are coming with the complaints of the above mentioned clinical manifestations, such as patient is having hematuria, patient is having pain in the urination, patient has the risk factors of a family history or a personal history of a bladder cancer, patient is complaining of the polyuria. So for those patients, the diagnostic tests are being done to get a confirmatory diagnosis whether or not what is the condition of the patient's bladder. So number one is intravenous pyelography. So intravenous pyelography is a procedure in which first of all patient is asked to not eat or drink anything before the procedure. After that, an IV drip is being started for the patient. After an IV drip is being started for the patient, what the patient is being done is administered with an antihistamine drug and the x-rays are being taken for the patient. After the x-rays are taken priorly, the patient is now administered with a contrast medium within the IV drip. Now after administering of the contrast medium, again the patient x-rays are being done so as to identify which region is being affected within the bladder. So this procedure is called as an intravenous pyelography. The second is coming as a cystoscopy, examination of the urinary bladder with the help of a scope. The biopsy, we are taking a sample of the tissues within the bladder and examining the tissues under a microscope to see the changes within the layers of the bladder. Urinary cytology is being done. CT scan and MRI are the few of the standardized tests that are being done when it comes to the diagnosis of any type of the cancer. As you can see within the cystoscopy, through the urethra, a cystoscope is being injected into the bladder to identify and visualize any of the abnormal growth patterns that can be seen within the bladder. The bladder biopsy. So biopsy is basically taking off the cells from within the bladder and examining it within the microscope. So what is done is small instrument is passed through scope, grabs and removes small tissue of the bladder lining. So when the scope is being passed within the bladder to visualize the bladder, along with that another instrument is being passed through the scope which grabs a piece of the tissue. Now area may be cauterized, pinching sensation and blood in urine. So after that, the patient, what is going to be experiencing is a pinching sensation, and for some time the blood in the urine is going to be present for the patient. So this is how the biopsy of the bladder is being taken, and the cystoscopy is being done as a diagnostic procedure for the patient. Now the management. Now again, when the management has been taken into consideration for any type of the cancer, it standardizes to the chemotherapy, the radiation therapy, the immunotherapies, the targeted therapies, and the surgeries. But when it comes to the bladder cancer, there are certain types of the therapy that are set aside for the patients. The number one being the chemotherapy. So the chemotherapy is administration of the anti-neoplastic agents so as to destroy the cancerous cell. So when the anti-neoplastic agents are being administered, single agent or a combination systemic chemotherapy. So either one single drug is being used so as to destroy the cancer cells, or a combination of those drugs are being used so as to destroy the cancer cells. Again, when chemotherapy is being given, the body is going to show certain side effects. So the management of these side effects is very much essential when it comes to the chemotherapy treatment, because the patient is also in a very vulnerable state because of the cancer, and thus these side effects need to be controlled so as to provide a greater deal of comfort for the patient. Dose dense MVCA. So MVCA basically stands for methotrexate, vinblastine, adriamycin and cisplatin. So dose dense MVCA are these drugs, methotrexate, vinblastine, adriamycin and the cisplatin are being administered to the patients. Gemcitabine and cisplatin are also few of the other drugs that have been selected for the patient's treatment. Radiotherapy is the second option of the treatment. So within radiotherapy, basically it can be an external beam radiation or internal radiation. In the external beam radiation, rays of the ionizing rays are being passed within the patient's body externally so as to destroy the cancerous cells. Within the internal radiation, a radioactive isotope is being placed within the body. But when it comes to bladder cancer, small muscle invasive bladder cancer, if it is a small muscle invasive bladder cancer, the radiotherapy is a treatment of choice and also can be used in a palliative treatment. When no other treatment is starting to show effect on the cancer, now the palliative treatment is the option. What is a palliative treatment? Is basically we are trying to control the symptoms of the cancer so as to provide the patient relief from the cancerous cells. And for those patients, the radiotherapy is said to be a treatment option. Coming to the immunotherapy, when the immunotherapy has been taken into consideration, it's also called as a biological therapy, where basically we are doing is boosting the immune system of the patient. By boosting the immune system of the patient, what is being done is that we are increasing the body's ability to fight the cancerous cells. And not only we are increasing the body's ability to fight the cancerous cells, we are trying to boost the immune system. So BCG vaccine is infused through the urethra into the bladder once a week for 6 weeks to stimulate the immune cells to destroy the cancer cells. Sometimes BCG is used with interferon. So BCG vaccine which is being used is they are injecting the vaccine through the urethra into the bladder once a week for a period of the 6 weeks so as to boost the immune system. So not only this way immune system is being boosted, they are trying to destroy the cancerous cells by boosting the immune system by administering of the BCG vaccine. Sometimes BCG is used with interferon. So now a combination is also being used when it comes to immunotherapy, that is BCG is being used with the interferon. Moving forward, looking at the surgical management. Now when surgery is taken into consideration when it comes to bladder cancer, it consists of the radical cystectomy. So removal of the entire bladder as well as its surrounding lymph nodes and the other structures that may contain the cancer. So the radical cystectomy focuses on removal of the urinary bladder. Now we are not only removing the urinary bladder but also the surrounding structures. The surrounding structures that seem to be having the cancerous growth, such as the lymph nodes and also any of the other surrounding region of the bladder which is having the cancerous growth, are being removed in the radical cystectomy. As you can see, the patient is having a neobladder, that is a stoma is being made outside the body and a pouch is being made inside the body through the ureters. They are basically anastomizing of a part of the intestine so as to create a pouch inside the body, and the stoma is being brought out so as the ureters are emptying the urine within those pouch and which is being collected through a stoma outside a bag. Segmental or partial cystectomy. Now segmental or partial cystectomy indicates partial means a part, segment means a particular segment. So as you can see in the picture, in a partial cystectomy, a part of the urinary bladder consisting of the tumorous growth is being removed. and the rest part has been sutured back together so as to cause us a partial cystectomy. In a total cystectomy, as you can see, the entire urinary bladder is being removed off, and a part of the intestine has been taken and anastomized and brought on the surface, and creation of a stroma where the urine is getting collected outside in a bag. There is one more procedure when it comes to surgery, is a transurethral resection with fulguration. So transurethral resection with fulguration is basically done is through the urethra, they are trying to insert a cystoscope, and fulguration includes of the use of the diathermy to destroy the cancerous cells. Nursing management. Now when a nursing management is taken into consideration, what basically revolves around is the post-operative management. Now, after the surgery is being done for the patients, what is being done is teach patient to perform cough and deep breathing exercises, use of incentive spirometry. Now, the patient is being taught regarding to do the deep exercises with the use of the spirometry. Now, observing for the signs of hemorrhage. Since when the patient is even experiencing such major surgeries, the signs of hemorrhage are very much visible when the patient is having hemorrhage. And this is a major surgery if it is a total cystectomy. So the patient should be observed for any visible signs of the hemorrhage and need to be immediately reported and taken into the care of. Monitoring the vital signs, that is the temperature, blood pulse and the blood pressure and the respiratory rate need to be focused, and the baseline data has to be observed and the changes are need to be noted down. Providing pharmacologic and non-pharmacologic pain relief measures. Not only the pharmacologic pain relief measures have been taken into consideration, but the non-pharmacologic pain relief measures are also taken into the consideration so as to provide the maximum comfort to the patient. They furthermore consist of assist patient to minimize irritative voiding symptoms by fluid management and avoidance of bladder irritants. Now the patient may be complaining of irritative voiding patterns. So methods need to be taken into consideration so as to avoid the irritative voiding patterns, and the patient will be having the avoidance of the bladder irritants. No any factors need to be taken by the patient that can irritate the bladder. Management of the chemotherapy side effects. As discussed earlier, chemotherapy is going to cause side effects which are going to be a variety of the side effects such as vomiting, nauseous, feeling of uneasiness within the patient, and these side effects need to be managed very well so that the patient's comfort level is being maintained. Monitor the laboratory risk tests. The patient is going to be undergoing continuous tests when it comes to the any type of the treatment, specifically in any of the cancer treatment. So that monitoring of the continuous laboratory test has to be done. So bladder cancer basically focuses upon the cancerous growth within the bladder. It can be of any of the types and the stages. And the management focuses on chemotherapy, radiation therapy, or of any of the cystectomy, whether a partial or a segmental or a transurethral fulguration. And the focus has also been placed upon the nursing management by the nurses. Thank you.